And there we go. It's Wednesday, 3 p.m. Eastern. Hi, all. I'm Dave Williams, your host from findyanewnormal.com, and I welcome everybody. This is great. Got another audience growing by the second. I'm watching the numbers go up as the show gets underway. Really excited that you're here. And as you know, every week we try to talk about a variety of the issues that cancer patients and survivors, caregivers have to go through as they are on this journey with cancer in their lives, from the moment of diagnosis through to treatment, post-treatment, survivorship, and hopefully wellness and vitality. It's quite the journey. I'm a cancer patient and understand it. And as a result, try to bring other cancer survivors and folks that are good resources to us all who are dealing with many of the issues that the Cancer Registry talks about, whether it's dealing with the psychosocial side, the spiritual, the financial, the motivational, the rehab, the nutrition. There's just so much that we end up all having to deal with in some way. And every week I try to get the conversation in a casual way and share it with a co-host. And this week, somewhere on the screen, either below or to the side of me, is Tracy Maxwell, a personal friend, a cancer survivor, a great guest on past shows, and a person who is helping me out today because Hayley Dubin, who usually is here, had a prior commitment and couldn't join us, but Tracy came in. So Tracy, could you say hello to everybody, maybe share a little bit about who you are, why you're here, and set the stage before we introduce Alene, our lead guest today?
Absolutely. Yeah, thanks for inviting me. I'm glad I was available to join in last minute. I love these blabs. They're so great. My work is mainly around helping people heal, and my business is called Solo Survivors. I wrote a book called Being Single with Cancer. It's based on my own experience and a survey and interviews I conducted with 100 other single survivors to find out the greatest needs among that population. And I absolutely love coaching people, helping them with survivorship. That tends to be, Alene, where I coach the most people. Even though I would love to help coach them through their whole treatment experience, I find that they're often overwhelmed and they really need and want the most help when treatment ends. Their support network goes away and they're trying to make sense of their life after cancer. So they're trying to find their new normal. So the work that Dave's doing is so congruent with what I'm doing, and I'm absolutely thrilled to be a part of it.
And I'm thrilled to have you part of it. It's really exciting. And I got to make you blush a little bit because I think you're just a very special woman. And you know that every time I get you on the show, I talk about how valuable your book was. And to me, as a person who's single, and the fact that it's a workbook, not just a book. But more importantly, I've seen you over the years develop into really a thought leader, because although you are framing yourself as someone working in survivorship, your overall message is love your life now. I mean, it is something that's much broader. And being enough is really a tagline that I picked up from you. In fact, I know you have a course on being enough. And hopefully people will spend some time and visit you at your website. I am Tracy Maxwell. And please, Tracy, make sure that link is in the text chat so that people could get to know you. But folks, you really should get to know Tracy. She's a pretty special lady, just celebrating, what, a 10th anniversary now? And you're doing some special things in Denver at CancerCon next week. Isn't that right?
That's right. Yeah. May 23rd is my 10-year cancerversary, 10 years from when I was diagnosed. So I'm celebrating big this year. And some of the exciting things that I'm doing are I'm raising money for 4 different organizations that really helped me tremendously through my experience. Dave, one of which was our connection to each other, was through Marcia Donziger at mylifeline.org. Yep. And then First Descents, an organization here in Colorado that I bet Alene is familiar with, that provides outdoor adventures for young adult survivors, including kayaking and rock climbing and surfing. And Athletes for Cancer, which does a similar surfing program for young adult survivors in Maui. They do 4 camps a year, and it is such an incredible healing experience in Hawaii. And then Cancer Cooperatives Coach Cancer Program, another area, Dave, that you are passionate about as cancer coaches. And Gavin really discovered that coaching made a huge difference for him at the end of his cancer experience, and not just for his personal life, but his career. And so he really wants to make that available for other survivors. So I'm super excited. My goal is to raise $10,000 for my 10-year cancerversary to support those 4 causes. And there's a whole page on my website about it. And next weekend, yes, CancerCon will be here in Denver, Young Adult Cancer Survivor Conference. I speak there usually every other year, but since it's been in Denver the last 2 years in a row, do a session for single survivors. So if you're going to be there, please stop by and say hello.
See, we're just full of information today. I just love this show. We get to hear everything that's happening. We should do a show every couple of weeks on just events, what's happening, who's doing what, so that we all get to hear what is available, because there's so many exciting people. And in fact, that's why I'm excited, and everyone can tell they know I'm always amped up. But today I'm a little rocking it because I've got Dr. Alene Nitzky with us. And I'm so pleased to have Alene with us, because she's been working on a program for quite a while, and I've been following that existence and development. And finally, it's been launched, Cancer Harbors, and really, really been trying to find time in her incredible busy schedule to get on air with us and help us understand what she's been doing. So, Alene, I'm going to just say hello and thank you for coming. And before we get into what you're up to, just tell the folks out there who you are, where you've come from, and why we should all pay attention to what your message is going to be today.
Well, thanks for having me on, Dave, and it's great to be here with you and Tracy today. My background is in oncology nursing. And before I became a nurse in oncology, I taught at the college level in exercise science and wellness. And I also had my own personal training business where I worked with people who had chronic health conditions. So if I backtrack a little bit, back in the day when I was doing the personal training, and I was in my late 30s. And I started having some health problems myself. I just had a lot of fatigue, and anyway, I won't go into all the details, but eventually it took several years to figure out that I had thyroid problems. I had Hashimoto's thyroiditis. Well, in the process of trying to get treated for that, I ran into a lot of issues. And see, I have been a competitive ultra runner, an ultra endurance runner for 25 years. And so I expected a lot out of my body. And when I started having these problems, I was trying to find a doctor who would work with me and who would take me for who I was, and realize that for me, quality of life was being able to compete in my sport and to have that kind of energy. And all they would do, these doctors would, give me my thyroid medication, and they would say, well, your labs are in the normal range. There's nothing else we can do for you. And I wasn't getting any better. Well, after going around looking for doctors, I finally found an endocrinologist. She happened to be a thyroid cancer survivor. And she was the one who helped me, because she understood that it wasn't one size fits all. It wasn't, your lab values are normal, so you're okay. She understood there was more to that, and she understood about the quality of life. So that taught me first a big lesson in, being persistent and, not settling for less than what you want to make your life be. You don't want to, the doctor doesn't know who you are, and what you want. So anyway, from that point on, I was working with my clients, and I was hearing from them too that their doctors were always willing to prescribe medications, but when it came to quality of life, there was a lot missing. Anyway, I decided to go into nursing about this time because I felt like I could do more for my clients and more for people if I had the healthcare background. That's what I didn't have. And I went into nursing, and this is where I first started working with cancer patients. I got a job as certified nursing assistant when I was in nursing school on an oncology unit in a hospital. I loved it. I mean, I just thought I just felt like I was in the right place. So I went to nursing school, got out. My first job was in intensive care unit. Right as I started my first nursing job, my sister was diagnosed with breast cancer.
Yeah.
Wow. So anyway, that was just, she's doing very well now. She had surgery and she's done really well. But anyway, this all happened all at the same time. I worked in the ICU for a few years, just really started thinking, I really do need to go back into oncology. I really like that. So I found the first opportunity to get back into that. Then as I was working in oncology, I was listening to patients and their family members and going to support groups in the community because I was trying to understand what we could do to make things better. It seemed like they were getting lost. They'd get through treatment, then all of a sudden they felt lost. They didn't know what to do. There was no support afterwards. And it was at the time when survivorship care plans were just starting to become, something that doctors used. It wasn't universal. It's still not universal, but there are more of them now. But anyway, these people were just getting lost and their quality of life was not so good. And they were just trying to find their way back to, feeling better. So after all of this, I realized, hey, I've got the skills to, from my nursing background and the oncology work, and then the health coaching and the exercise training and all the wellness, everything that I had done all my life had it made sense for me to do this. So I decided that I was going to try to develop some kind of a plan or a program for people to help them recover. So
that's an incredible journey, don't you think, Tracy? Isn't that something? I'm just fascinated that someone who's got an academic background decides to jump into nursing to help people, so you move from head-centered to heart-centered. And then in nursing, you decide that oncology is the direction. And then from there, you decide, I better help people with some practical things and get into coaching. And now, as we'll get into in a few minutes, you've got something quite exciting. But that journey, what do you think of that, Tracy? Isn't that an amazing path?
Dave, this is something you and I have talked about. And I spoke yesterday, Alene, at a local hospital at their breast cancer support group. And this came up again there, that when you're going through treatment, you get diagnosed, you're shell-shocked. And then you're going through treatment. You just put your head down. Like you said, doctors with the medication, they're very focused on your physical well-being. Very few people have someone who's paying attention to their emotional, their spiritual well-being. And then you finish, and especially when you're single, there's been this amazing support network around you the whole time you're going through treatment. And the minute you're done, everyone goes away. I mean, they go away whether you're single or not, but when you're single, you really feel it because that's been your whole support network. And so I love that you're focusing on that survivorship piece. Right when people need a different kind of support, they don't realize they're going to need it. They don't know how hard that time after treatment is going to be. It's so crucial. So I can't wait to hear more about what it looks like. I think it's really, really important. And you have such the perfect background to be doing this work.
And you can see in the text chat, I mean, people are supporting you. Carol's there and says, love that you kept following your passion. What a great way to develop a great practice as an oncology nurse. I mean, and folks, just keep putting your comments in the text chat that we can interact with. And if there's a question that you have, just do a /Q and then a space and then your question, and it'll show up on the screen. And in a few minutes, we'll turn on the camera, a extra seat, and you can actually interact with us. But right now, we're just sort of exploring, what is this journey of cancer, and is thriving? Can you thrive, or is it just surviving? And what we're hearing right now is from a professional who's been through this and has come up with some interesting ideas. And now, you have this concept, that I just love the name of Cancer Harbor. I love the picture that it brings to my head of a harbor for cancer patients, survivors, and caregivers. I just love the image, and I love the website. If those people, please go to cancerharbors.com. You're going to see this great graphic, of a sailboat on the water. It's so inviting. I'm gushing here, so I better stop. Over you to Alene, and tell us more about what the cancer program is all about.
Okay. Well, Cancer Harbors is designed to be a year-long program. And ideally, a person would start it sometime in the few months after they complete treatment. But it doesn't have to be like that. You could do it, if you've been out of treatment for a while and you still feel like you're struggling with some things. You could also start it when you are in treatment, but that's really not ideal because there's a lot in there that treatment just takes so much out of you. It's really better to kind of get past it. And the reason why it goes for a year is because a lot of times when you get through treatment, you might feel a certain way about things. And there's just a lot that happens down the road. You just don't really know what's going to happen, how you're going to feel 3 or 6 months down the road. If some issues are going to crop up later. Sometimes you think you're doing okay, and then all of a sudden something triggers you and you're back to, struggling again. And sometimes, as I'm sure a lot of you know, if you have treatment like chemotherapy or radiation, especially, sometimes you don't even see the effects of that for a period of time later. So this is designed to guide you through a period of time. As things come up, you have lots of resources to dig into and an opportunity to ask questions. And that's where I come in as the coach. So what Cancer Harbors consists of is video conferencing. And I'm going to start out offering 10 sessions per month, so an hour at a time. And I'm going to spread those out so people in different time zones can take part, different times of the week. And I will adjust that, depending on what the need is and what the demand is. So you get a chance to ask questions and interact with me and with other people. I have a discussion forum, so you can ask questions and get answers anytime. I have a library of information, and it's a lot of material, but it consists of activities. It's very skill-based and activity-based. So you have suggestions of things to try. If you're having a certain issue, there's a whole list of things that you can try. And, some things will work for some people, some will work for others. But you have options. And if you're having trouble with it or you have a question, that's where you can get on the video conference or ask a question on the forum and interact with me, ask how it's going. Other people can also answer questions, or, you can compare how you're doing.
So it's a group program. It's not just an individual, although I can treat it as an individual step by step, but there's people involved as well.
Right. So you have the option, you can get more involved in the group, or you can do it on your own. You don't even have to partake in the video conferencing if you don't want to, but it's a huge part of Cancer Harbors is being able to interact and get feedback. And it also is a way, if you set it up, if you make a commitment to doing the video conferencing, it'll also help hold you accountable. So that's, the face-to-face interaction is important. There are also exercise videos. I have a whole library. Dave and I were just talking about this before we started. I made up a exercise library. It's got 80 different exercises, and they're individual exercises, and they're all designed for improving physical functioning. And not only cancer survivors, but also caregivers can benefit from these. So they're very useful. And then you also have an opportunity, if you want even more personalized attention, one-on-one, you can sign up for sessions with me. That costs addition, that's extra, but it's totally optional.
It's an unbelievable layout program. In fact, when I started looking at it, it was, it's like a university. Oh, yep, she's a Ph.D. She's looking at this from a compendium of information, articles, PDF files, videos, content. Well, wait a minute, she's also a coach. She's got the heart center. She wants to help. So there's human interaction, there's video interaction. Oh, but she also believes in everyone supporting each other. So there's group teleconferencing sessions or group video conferencing sessions so that people can support one another. It was sort of a blend of everything that you've seen out there on the market, all in one spot. I just thought that was so innovative that you put it together. And it's also self-guided, that if you really wanted to do it by yourself, you could work at your own pace and then interact and put your hand up when you need help. It had so much flexibility, so much depth. The content was so excellent. This is a double A+ solution. I mean, it was just an amazing thing that you've done, Alene, and everyone give her props. I think it was just an incredible solution set. Really should be proud of what you've created.
And, the nursing background too, Alene, I am sure everyone in our audience would agree. I mean, the nurses were the ones who saved my life in the hospital. They're the ones who are there all the time. The doctor might whiz in and do a quick checkup. But when I was in the hospital, it was the nurses that made such a huge impact on, again, not just my physical well-being, but my emotional well-being, my spiritual well-being. And I have several friends who are nurses, and I just give nurses so much credit, especially in oncology, for making a huge difference for patients. So thank you for bringing that experience to this as well, because I'm sure what you saw in the hospital and with people going through treatment really contributed to this. Is there a story you can share about a patient that really motivated you to be sure you got this done?
Well, I mean, trying to choose among all the patients would be really hard. But, I would say that with the clients I work with now, like, for example, here, I'll just give you an example. I'm going to change a few little details because I don't want to, give away anybody's identity. Sure. But, I have a client who has other health problems in addition to her cancer. And she went to, I won't even say where she went. I don't want to give away any details, but she went somewhere to get some help with exercise. And they tried to put her on this general program that worked for everybody. Well, because of her health problems, in addition to cancer, it turned out to kind of be a disaster for her. So we started working together, and really what she needed, all she wanted to do was to be able to go out and do grocery shopping and to do her everyday activities that she used to do. She just wanted to, be able to go out to lunch with her daughter or go to the store and walk around. But she was so weak that, she could really barely do anything except just be around the house. She got a Fitbit and started tracking her steps, and she could only do 700 steps at the beginning, and that was several months ago. We've been working on an exercise routine that she can do at home with her walker, and she's building up her bone mass. She's increasing her endurance. She's up to 4,000 steps a day. Wow. Her goal is to go visit her family across the country. So she will have enough strength to go through the airport, get on the airplane, go visit, do a few activities with her family. And that's what she wanted. That's really all she wanted. But she needed the strength to be able to do that. And really what it took was endurance and, being able to rebuild the muscle mass that she'd lost. When she went to this other place, they just put her through this battery of tests, and they were going to have her do certain exercises, but they weren't applicable to what she actually needed to do. So that's another thing I do with my clients. I listen to them and say, hey, this is what, this is what you really want. You have to really listen to what the person wants. And so you make the decision about what's important to you. And Cancer Harbors allows you to do that.
It's such a nice guided program that you start off assessing what you need, and then you go through this huge library of information. I mean, just the example that you shared, I mean, people who followed our show know that I had an extended hospital stay, but when I was sent home, it took me 4 months to learn how to walk again. It's because I could barely get up and down the stairs, and my goal was to get down the street to the coffee shop, and I needed to figure out how to walk again, how to get through the stoplight, how to wait at the stoplight for someone else to come to walk me across the street in case I fell. These little things that were so important to me in order for me to recover, I think your program would have been so helpful for it. Because not only was the exercise there and the video training me what to do and the articles of what it was. I mean, if I want to understand muscle mass and, what protein is doing, because we'll talk about your nutrition background. It's a whole issue of you've lost your muscle mass. You've got to put protein on. You can't do the walking without it. You've got to get a holistic approach. It's just a comprehensive system. And I've got to reveal it now because people are saying, well, if it's so good, it's going to be hugely expensive. I'm paying $500-600 a month for coaching services. Not the case. And I'm just going to let you reveal your pricing structure because I still don't believe it.
Okay. Well, I'm just going to say this. It is at a very low cost right now. It is going to go up, but it's still going to be very reasonable. Right now, I'm offering it for $185 a year. Or $17 a month. That's to begin with.
Yeah, see Tracy's face? You see what she just did? That's what everyone does. $17 a month? You've got to be joking. Got to be joking.
It's going to go up. It's going to be more like $25 a month and under $300 a year. But the reason I can do that is I'm using the technology, the video conferencing, which is very inexpensive to do. And of course, it's not private one-on-one coaching. You are going to be in a group. It's not like if you want that, you can sign up with me for, a private session, but it is going to cost you more. But what I wanted to do was provide this information for people and allow them to process it and read it and learn from it and then be able to ask questions. And I have to necessarily be there 24/7, but I'm going to be checking in all the time. And I will have all these opportunities where I can interact with you one-on-one, if you attend the video conferencing, and I plan to make that convenient. But video conferencing is a great platform to do this. And it's very inexpensive. So, and I'm not here to, of course I need to make a living and I have skills and I believe that, yes, that I should be able to make a living, but I don't want to keep people from being able to access resources that they need because they can't afford it. That's really important to me because financial stress is such a huge part of, having to go through this whole experience with cancer. So I don't want to leave people out. I want people to be able to use this.
It's just an amazing, and people say, well, it can't be done. And I'm saying, hey, I'll just put my 2 cents in. I've talked to Alene about this for months, about her pricing structure and what she's doing. And she's dead serious. She wants to make this as low cost as possible. She's got to make some money off of it. But $17 a month is not a great problem. And she is quite willing to work with other coaches and practitioners. So if you want to embed this service into what you're doing one-on-one with your own patients, that's quite acceptable. She would like to work with you and get to know you and find out what additional resources she wants to add into the library. So if there are some coaches, I see Avi here, Carol's here, Beth is here, other people who are joining in. If you visit with Alene, you'll see all the level value that's there. And then you can work with her in terms of how you would offer that back to your clients. But, and don't forget that it is also designed to be a gift from the caregiver to their loved one, which I thought was so clever. I know my family who were trying to support me were desperate to try and find a way to help me. And, it would have been so great for me to say, hey, could you spend the $200? I can't. Could you buy that for me? And I'll have a year of support, help, articles, information, one-on-one contact when I need it. I'm sure that the caregiver, will dig into their pocket and spend the $200. I mean, so it's a gift package that you can do. It's something that can be embedded in with coaches who are already working with patients. And for those of you that are a survivor and need additional help, you can just jump in because $17 is not a big problem. Avi's saying, why not 25? It's it would still be a nice number. Let me turn on the camera as we talk, because I'm sure people want to jump in, and I'll unlock the seat in case anyone wants to jump into the conversation. But I was just blown away by the comprehensiveness and the pricing structure. I mean, it was just so good, so good.
Well, one of the reasons I also want to keep it low is that when I provide guidance and coaching, a lot of times we find out that the person does need some specialized attention, a professional assistance. Just say they need counseling from a mental health provider, or they really do need nutrition help from a professional. It costs money to do those things. I want to be able to provide the coaching and to guide people in what they need, but without making it so expensive that it's like they're paying another provider already and they can't afford to go get that help that they need. Mm-hmm. That's really important, because I can't be all things to everybody, and I can't, I'm not a psychotherapist. I'm not a registered dietitian. I have a very broad approach to this, but I don't have the professional skills in every area that people are going to need. But I want them to come to me and say, hey, I'm having trouble with this. What should I do? I don't know what to do. Say, hey, you may need to go see, get manual lymphatic drainage, or you might need to go get, nutrition counseling, or that way they can afford to go get that without me being another financial burden on them. So,
do you plan on working with patient navigators? Because I know there's a lot of states that are getting, oncology nurses to help the patient move through the treatment program. And then they, as we all said, you graduate from your program and now you're on your own. But that patient navigator could interface with you and your program to do a handoff. It's like pass the baton over. You're finished the treatment program with a professional oncology nurse. You're coming back over to another oncology nurse, but with a coaching and systems-oriented solution set. I could see how that could be a nice transition.
Yeah, and I am reaching out to patient navigators and also case managers, discharge planners, oncology social workers, people who are going to interact with the patients at the point where they need this kind of assistance. One of the things with healthcare right now is, people are very limited in terms of the time and resources that they can put into helping patients. Unfortunately, that's just the nature of healthcare these days. And so, this is something that they can refer a patient to. They can say, hey, well, you're done with treatment and our time here is done, but here's a place where you can go to get additional assistance. And that is where I'm connecting with. I'm trying to, make those connections to get the referrals.
Avi in our text chat is saying cost is not the only issue. It's not, or rather cost is not only financial. There's emotional and mental costs as well. And I think that is what intrigues me, is that you're allowing to pass the baton, help the person deal with the support issues of recovery. Because it is a very difficult thing to be a survivor. It's not like a broken arm or a leg. You put a cast on it, it heals, and you move on. It's like you have constant issues that go, some of us 10 years, 20 years later, and we're still got issues that we're trying to deal with, emotional and psychological. And that's where working with individual professionals come into place. And I really see a marriage happening. You know, people like Beth and Avi and Carol and Tracy and other folks that, you know, do this incredible professional one-on-one work can work with this content to add an extra dimension to what the caregiver or what the patient really requires. And that's not been done. Everyone's been in their own little cocoon doing their own thing. This is the first thing I've seen in the survivorship world that says, you got a survivorship plan. You're supposed to do something with it. It seems to be medically oriented. Here's your checks. Here's your scans. Here's your blood draws. Here's your medical history. And then the emotional, psychological, and process stuff is left off. And then it's up to you as the patient to take your plan into something else. I think what Cancer Harbors does is that first step now blended in with either Alene as your coach or Tracy or any of our professionals working with the patient. You've got an incredible solution set. Just amazing. It blows me away.
Absolutely. And, you know, at C. Bush RN said she loves the gift concept too. And I have to say, I agree. It makes so much sense because, again, as a single survivor, one of the things I found was that I had to learn how to ask for help. Mm-hmm. And when I didn't get it. And I could sit in my condo and be bitter and upset that people didn't know what I was going through and that they weren't showing up to bring me meals. But when I reached out and was vulnerable and was able to authentically share what I was struggling with, people showed up in droves to bring things and to offer things. And I remember one point, there were all these books I wanted to read about nutrition and alternative healthcare, and I couldn't afford to buy them. So I put them on my wish list on Amazon, and my friends bought them all for me. So people are desperate to find a way to help the patient when they're in need or the survivor. And by giving them an opportunity, it's brilliant. That's such a great way to say to people, hey, this is a small amount. You could have a different friend fund each month if you wanted. If one person can't afford to pay for all of it, you know, there's a way for a lot of different people to get involved and do that. Someone did that for me when I got Reiki treatment through a great local organization called LifeSpark. They offered Reiki during cancer treatment, and someone paid for it for me. It was only $20 a session, but it was still too much for me given all the other expenses I had at the time. So I think that's such a great way for people to learn how to reach out and ask for help, and for other people who desperately want to find something that they can do to support the patient or the survivor to do that.
Yeah, I can't even tell you how many times, you know, I hear from people, well, you know, so-and-so just got diagnosed with cancer. What can I do to help them? You know, I don't know what to do. Hey, this is great. You know, I mean, support them the whole way, even afterwards, because they forget, you know, people don't know a lot about the whole process of cancer unless they go through it themselves or with a close family member. But a lot of people think that, you know, when the treatment's over and your hair grows back and that everything's fine and you just go right back to living your life. And it's not like that at all. And they don't realize that there is such a need for support. I mean, the recovery needs last so much longer than treatment ever does.
Totally.
And so if we can, you know, educate the public about that so that they understand there are still needs. Don't forget them after they're done with treatment, because it's not all done. So that, the gift thing is an opportunity to do that. So, yeah.
And just to remind everyone, the camera seat is open. The fourth seat is open. So just hit that call in button and click there, and we'll get you on camera and you can ask your questions. I'm going to throw out an idea that just went through my head, Alene. You can tell me whether it's crazy or not. But one of the biggest issues that I've heard from cancer coaches is they can't get the attention of the cancer clinics, because most cancer coaches don't have a medical background and they're not seen as professional or credentialed enough to be part of the survivorship clinic or the transition from outpatient to home patient. And so they end up searching for patient clients all on their own, doing the standard marketing 101. It just struck me when you said, hey, you're going to knock on the hospitals and the cancer clinics as wearing the hat of the oncology nurse and saying, hey, I'm a professional like I'm one of you, and I've got a solution that you might want to, offer to patients leaving your cancer treatment program. I'm wondering if a coach worked in conjunction with you and that coach could enter hospitals all around the country, that coach could now get in to talk to the patient navigators and the oncology team, coming in as a representative of Cancer Harbors and your credibility to let them introduce themselves and your program, and then they can be trained by you how to administer that program the way it fits within your professional standard. But they're looking to get into the hospitals and they can't. You are one of them, so you can open that door. If they were arm in arm with you, I'm wondering if they could find more clients, more patients that way. Would you entertain working with, cancer coaches that way, knock down the doors of the clinics?
I'll tell you what, I mean, I certainly would not be opposed to doing something like that. I hadn't even thought of it that way. But I'll tell you what the issue is, or the issues are. It's not that they won't take the cancer coaches seriously or as professionals, but the way healthcare works, especially in the United States, these big organizations are, we've had all these mergers, and there's just these huge healthcare conglomerations, and profit really is their focus. And by listening to someone who's outside of their organization, it's like they're afraid they're going to lose, some market share to those other people. And the other thing too is about the reimbursement, because, for health insurance does not, for the most part, reimburse for cancer coaching. I would love to see that happen. So what I could see is, maybe cancer coaches need to form a coalition of our own and start going after these organizations and saying, hey, your patients need us. You will have so much more patient satisfaction if you can give them what they want afterwards. Don't just abandon them or just say, we only want to see you when it involves, medical treatment that we can, that insurance will reimburse and that we make a buck off of. Really put your money where your mouth is. If you want to help people, you need to refer them to people who can help them outside of and afterwards. So, because I'm having enough issues, with just trying to get in and talk to doctors myself. They don't have the time. They don't have the time, basically. They're just overloaded themselves.
Sure.
So that's an issue. But I think that by banding together, cancer coaches could definitely figure out a way to make some inroads there. And I'm definitely open to that. So, get a hold of
lots of possibilities. I mean, that's what excites me about. I love our show because we meet all these new ideas. They come onto the market and say, well, what will we do with that? The patient needs help. The cancer coach needs help. The caregivers need help. Survivors need help. Everyone's needing help. They all are healing and dealing with suffering of some degree. And we've got to try and offer the solutions that are going to add some benefit to them. And I think, on Tracy working with the survivors that are single, and you working with this very large compendium of information, there's just so many exciting things for all of us to pay attention to. And I'm looking at it through the eyes of the patient, the survivor. I mean, I don't know what I am, because I still am in clinic. I still have treatment. I'm supposed to be a survivor, but I think I'm still in treatment. I don't know what I'm at. All I know is I need help. And that's why I love meeting people like you. And because I can say, oh, there's someone I could talk to. There's someone that I could do something with that would make a big difference. And there are so many exciting people out there. And that's why we've had the coaches directory. If those of you go to findyournewnormal.com, you'll see we've got a directory of cancer coaches, and people are saying this is what they do, and they've got a video explaining who they are, so you can decide, are they the kinds of people that you want to work with? And then there's innovations that we're hearing of today. This is a moving target. So those of you that I know are in the hospital, because I talked to a couple of you on Mondays, at Juravinsky. I know you got your smartphone open. You're sitting there. There are solutions. I got through it. Tracy got through it. So many of us get through all of this. There is a journey that is not one you would choose to get on. Although, come to some of our other shows. We've shown you where the gifts and blessings are in cancer. But it is one that you definitely need help all the way through it. And, to have someone like Alene come on and say, this is what we're doing at such a comprehensive service at a very low cost for the program is just an amazing thing.
Dave, Avi says you're the glue that brings it all together, and I have to agree. You are. You bring together these great guests, these awesome programs, and you provide a platform for other people to find out about them, and that's so valuable to this community. We appreciate so much that you do that.
Thank you, Avi. Thank you, community. Thank you, Tracy. It's my pleasure. It's someone taught me way back when I was diagnosed that if I wanted to heal, I should put my arm around somebody else and help them. And I'm just amazed by that little piece of advice. That I love this show because I'm simply trying to give you all a virtual hug and say, here's what you could do. It's something that I think is worthwhile, and I know will it makes a difference for me. Maybe it'll make a difference for you. Pay it forward. Angels came and helped me in many, many ways. I think there are resources out there, and I swear some of the people I've met actually have wings. I'm sure they do. At 2:00 in the morning, sitting in the hospital bed, I'm sure I saw a lot of people floating around. It was very strange. But, I
love what you just said, Dave. I'm reading a great book right now by Jerry Jampolsky, who started the Center for Attitudinal Healing, which now has locations all over the country. It started in the Bay Area. And the book is called Teach Only Love. I recommend it. And he said the same thing. He said they work a lot. They started working mostly with children, and they do some adult groups and some parent groups and some caregiver groups as well. But he said to the kids, if you want to heal, there's always someone that's worse off than you. So go put your arm around them and help them out, and that will help with your own healing. We teach what we need to learn, right? So it's really a great concept.
It's incredible. But you don't know what you're getting into. I certainly didn't know what I was getting into. I heard you got cancer, and I thought I'd be dead in 30 days. It's just that fear and anxiety and depth. You've got to understand the way the mind and the body interact. I mean, it's a very interesting combination that we have to learn about. And that's why I'm glad we have people like Avi Lerner in the audience who specialize in mind-body interaction and show us what that all means. Because the way you think literally does affect your healing process. And that's the key is to help all of us helping one another, and we'll make a difference out there. Look at that. I'm looking at the clock. We've almost finished a whole hour. I can't believe it. Are there anybody out there in the audience who want to come on and share something on camera, join in before we close out? Because we only try to record for about an hour, and then we'll hang around for a bit to answer other questions. But we've got about 10 minutes more of this recorded session. Anyone want to come? If so, there's a circle that says call in. Just click on that, and we'll get your camera on, and you can join in the conversation. It's so exciting to talk about this new opportunity that Dr. Nitzky is bringing to us today.
Well, don't call me Dr. Nitzky in the hospital because they'll get very confused. I go by Alene, but it is really interesting though when you think about with healthcare. There's so much in doctors are taught to treat, diagnose, treat, cure, and prescribe medicine. And that's what they do. And a lot of times, patients, they want more than that from their doctors, but really the doctors aren't trained in, behavioral change. They're not trained in getting well. There's a real difference between wellness and what we call healthcare. Healthcare is more like sick care.
Good point. Yeah.
Yeah. And so they're not really, if you expect your doctor to help you all the way through afterwards when you're recovering, that's not really realistic for what the doctors know how to do. So I don't like to bash doctors because they do a great job of what they do with medicine.
Saved my life.
Yeah, they save people's lives, and it's great. But the thing is that I would love for doctors to know more about cancer coaches and what we can do for their patients after they leave the treatment, because there's so much more. So trying to get them to make the referrals, that's where, that's what I need to work on, is getting, that's what we all need to work on, is getting in there. And
that's right.
We're important. Here's what we can do for your patient. And, and they, if they would take the time, that's the thing, taking the time to listen to us. That's the key. Getting your foot in the door is really, really hard. So,
Yeah, and you're so right. I mean, what you said earlier about how much they need us, because really they don't have the time to provide this for their patients. What they're providing is great. It's what they know how to do. And there is now this whole army of people that have sprung up to provide the service because it was something we needed when we went through it. And we didn't, the first thing I did when I was diagnosed, because I identified so much with being single, was look for resources for single people. And I didn't find anything, so I created something. And in my book, I write about all the other people who did the same thing. And here you are. You had an experience of someone not listening to you when you had a health issue, not hearing what your needs were, that they were different from the standard of care or the standard needs that other people come with. And so when you found someone that could provide that personalized service to you, you saw how important that was. And now you're doing that for other people. So necessity is the mother of invention. And there are a lot of people that are out there now available to help. And yes, it would be great if the medical establishment would help their patients find those resources. And we can do a better job probably too, letting them know that we exist. I love the idea of a cancer coach network that could, or association that could bring us all together to talk about these things with each other.
Yeah.
A lot of the body, we could become political. We could do all the things. This is the election year down there. I mean, we could get right into the swing of things, start to lobby. But you're right. There's so much going on, but we have a lot of resources. And those of you who are either here on the watching us live or the replay, remember that over on the text chat is an icon or an avatar of each of the people that are there, that are here today. And if you click on their picture, you'll see their profile, and you'll be able to follow them and get their Twitter account and DM them and start a conversation. I mean, Avi and Carol and Beth and Tracy, I mean, you can contact any one of us by just clicking on the photo, following them either directly here on Blab or within Twitter. And that way you can open the conversation and then start to share and connect. And maybe we can, get an association put together because there's a need for some organization. I think certainly the physicians at the two hospitals that I'm still active with don't know about coaching. And that's not just because I'm in Canada, but I talked to some people at Dana-Farber. I've talked to some people at Roswell. I've talked to a number of different people, and they don't know about the resources, and they get confused. Is that something like life coaching? Is it? No, they have not been educated. So we have a role through videos, through our video conferencing, through our blogging, to educate the medical community so they know what our role is and what we can all do together to help the patient. Because they do want to help. Now, as Avi says, their focus is on the body. It's healthcare. It is about, treating the disease. And I don't like it, but I am a chart number. I visit my guy and, he can't have a coffee with me. He doesn't want to get personal with me. He says 5 years from now, maybe, but not today. So I've done this, I've done this, I've done that. And that's the end of that medical treatment. But then my mind has to process that in a different way. And there's no one, as Avi is saying, engaging me within my body. The real me isn't being dealt with by any professional, even the social worker, even the psychosocial worker. They don't get into this wave that I know I needed as a patient, and talking to other patients as I do. We're all pretty well suffering, trying to figure out how to handle and cope with this thing of a journey, the roller coaster, the fight, the battle, whatever we want to label it, how do we deal with it? And it's really difficult to do this without the team wrapped around you. And that's what I'm hoping that those of you who are watching today or in the replay will connect with all of these resources that are there and help you find those solutions to what you're looking for. But there you go.
Well,
we're at the top of the hour. So Tracy, roll us out, and then we'll go to Alene for her final comments. We'll still be around on off camera, but let's end this recorded session. So Tracy, make your last comments and give us.
I'd like to wrap up by giving a shout out to some MDs who have seen that the system isn't working. And there are a lot of MDs who've written books about another way to do things. Bernie Siegel's one of my favorites. He's been around for a long time. Lissa Rankin, one who's been writing books more recently, Mind Over Medicine. There are a bunch, and of course, I can't think of all of them right now, but there's so many great books written by MDs. David Hawkins talks a lot about kinesiology, again, the mind, body, spirit connection, scientific basis for some of these things that we're talking about that Avi's mentioning. So there are a lot of doctors who've seen, hey, there's a better way. Lissa Rankin's whole mission is to heal healthcare, and she's bringing a lot of practitioners along with her with different things that she's doing. So if you're not familiar with her, go look her up. I'm on her mailing list. I read every email from beginning to end because I think the information is so valuable.
That's terrific. Thank you, Tracy.
Yeah.
And Alene, any final comments you want to make before we end the recorded portion?
Yeah. You know, one of the things that with Cancer Harbors, it is a very comprehensive program, and some people would call it holistic. And when I think of holistic, I think it's more than just what people think of an alternative to Western medicine or natural or something. I like to think of people being able to draw on the breadth of their own experiences, their own skills and resources that they have accumulated over a lifetime, and figuring out what do they already have to help themselves heal? What do they still need? And hopefully we can provide that through cancer coaching, through Cancer Harbors or anyone else who's a cancer coach. And we can help you fill those gaps in what you still need. But it's really a process that you need to go through, and it doesn't happen easily and it doesn't happen fast. You have to be willing to do the work of healing, but it is so worth it when you get that personal growth and that, you know, you never know where you're going to end up after, you know, doing this healing journey. So
very well said.
That's excellent. Well, let me thank you, Alene, on behalf of the audience. It was excellent to have you on. I know your schedule is swamped. You're in the launch. You've only been doing this for a couple of weeks, and it was so kind of you to spend some time with us and share what it is. But you know me, I've been after you for months for trying to get this thing going, and I couldn't resist. She's launched. We got to tell people about what she's now doing. So please go visit cancerharbors.com and sign up just for the information so that you'll get the notifications of what's going on. And if you do see a value in it, there's the gift side and there's the patient or survivor side, very clearly laid out. It's a nice, clean site. You can follow it through, find out what the whole program is. And as you can tell, Alene's a very friendly person. She'll gladly talk to you. She's not, even though she's Dr. Nitzky, she doesn't have the white coat and doesn't have a white coat syndrome. So she is willing to talk and share. So thank you very, very much for being with us today. I really appreciate it. And audience, thank you for being here. Without you, we wouldn't have a show. Please come back every Thursday at 3:00. We've got some exciting guests coming up. Next week, Ann Fonfer from the Appleseed Project is coming in. You know, she's got some interesting, talk about a research geek. I mean, she's got so many studies, just unbelievable information. And then Chef Ryan, if you have not gone to cookingforchemo.org, get there. Here's Chef Ryan, who is got a live cooking show with his sassy wife, Jessie. There's such a comic. They had their second episode this morning. It was just a laugh, teaching you how to cook from the professional eyes of a chef, But if you're in chemo and you've got all kinds of issues about food and taste or after, I mean, there's a lot of things that he's teaching that I'm getting, even though I'm not in chemo anymore. But it's enjoyable, it's fun, it's informative. You've got to go to cookingforchemo.org and check out what's going there. And then Breast Friends is coming up thereafter. And they've been doing some really interesting things for women with breast cancer. And then Sean Swarner, it's going to be such an exciting show on the 18th. I mean, Sean is amazing. First cancer patient to climb Mount Everest in July. He's one lung as a cancer patient climbing Mount Everest. He's climbing Mount Kilimanjaro. He's now got a project next year to unfold 1 million cancer signatures on a big curtain at the North Pole. He's going to go up there with his team. He's just an unbelievable guy. We'll talk about inspiration and motivation. If you think you can't get through your cancer journey, wait till you listen to Sean. It just blew me away. So we got some great things coming up. Please come back every Thursday, 3 p.m. Eastern time. It's a fun show that we have here with some interesting topics and hopefully offering a little virtual hug to help you deal with this crazy experience of cancer that you're facing. So thank you for everyone. I thank you sincerely for being here and look forward to seeing you again. So thanks very much. See you next week. Bye for now.